Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss the Ayurvedic herbal treatment for a very serious disorder known as Alzheimer's disease. Now, what is Alzheimer's disease? This is a chronic and progressive neurodegenerative disorder involving cognitive and behavioral impairment which severely impairs day-to-day activities as well as social and occupational functioning. Now, this condition causes dysfunction and atrophy of the hippocampus, which is a part deep within the brain, and this helps to encode memories as well as parts of the cerebral cortex which are involved in thinking and making decisions. Now, structural changes may begin to appear in the brain several decades before actual appearance of signs and symptoms. Now, Alzheimer's disease usually goes through 4 clinical stages. Initially, there are no symptoms, but gradually you see symptoms such as memory loss, getting lost, difficulty in doing daily activities, handling finances, making judgments, loss of spontaneity and initiative, and mood and personality changes. Now, as the damage increases, there is increased memory loss and confusion, shortened attention span, difficulty with language, learning, logical thinking, difficulty in recognizing people, and organized movement, and increased mood and personality changes and repetitive actions and statements. Now, when this is very severely impaired in the last stages of the disease, patients fail to recognize close or family members, become completely dependent, and lose all communication and sense of self. Now, there may be additional symptoms like weight loss, difficulty in swallowing, incontinence, skin infections, convulsions, and increased sleeping. So, this is a very serious disease which affects the person, and not only the person but all the caretakers, even the entire family. Now, senile plaques and neurofibrillary tangles are the hallmark of Alzheimer's disease pathology. Now, what is the modern treatment for this? Currently, modern medicines can only offer symptomatic treatment for Alzheimer's disease. Now, graded and interactive mental activities are known to improve cognition and slow down deterioration. Diets which reduce carbohydrate consumption and allow for increased consumption of fruits, vegetables, and non-farmed fish have been known to reverse mild to moderate cognitive decline. Now, in the absence of any specific treatment or cure for Alzheimer's disease, Ayurvedic herbal treatment can be used very judiciously with significant results. Now, Ayurvedic herbal treatment includes detoxification, treatment of chronic infection and inflammation, providing specific nutrition for degenerative tissues, opening off of damaged and blocked nutritional pathways, modulating metabolism at the general level as well as cellular level, and repair of reversible damage. Now, these actions are usually performed concurrently and may need to be tailor-made as per the history, clinical presentation, and specific requirements of each individual. Now, Ayurvedic herbo-mineral combinations need to be given for several months to reverse this pathology. In fact, sometimes treatment may be required for more than a year also. Now, the dosage depends upon the severity of symptoms. Patients with moderate and severe Alzheimer's disease require very high doses. Now, these are supplemented with herbs to continue mild detoxification, treat inflammation, and provide nutrition. While these medicines are administered orally, there are other treatment modalities also in use. Courses of medicated enemas and medicated nasal drops can bring about significant improvement. A special procedure known as Shirobasti, which uses warm medicated oils to be poured onto the scalp within special elongated skull caps. These are some courses are done for specific durations. Now, generalized skin massage and fomentation with medicated steam also provides good result. And exposure to sunlight, in Ayurveda it is known as Atap Sevan. This helps Alzheimer's patients to remain active in the daytime and sleep well at night. The consumption of various medicated oils, ghees, and bone marrow is also known to provide benefit. So, this is a combination of oral medication and panchakarma therapies. Even medicated enemas may also help very much. Now, most of these procedures as well as oral medications require some degree of cooperation from patients affected with Alzheimer's disease. Hence, it is advisable to commence Ayurvedic treatment as early as possible, preferably at the time of diagnosis. Now, this can ensure that patients get the maximum possible therapeutic benefit in the form of decreased symptoms, better quality of life, and reduction in mortality and morbidity. So, friends, this is a short description of Ayurvedic herbal treatment for Alzheimer's disease. Let's meet in the next video. Goodbye.